So here is a story, a few stories very quickly. I want you to come and focus on this figure later on. So here is a 13-year-old boy. He sustained gunshot wounds. In fact, this gun was recovered, and it was traced back to the DRC. You know, marking and tracing, so you trace it back to the DRC. I'll show you that map. And then all this happened, spent 14 days, and that follow-up. It consumed $3,000 US. You see what this means, because on its own, what's that? What's $3,000? You see what it means in our context, so that you see the sense of proportion and why we need to document this. I showed you this already. This is a close-up. This is a bullet recovered. Thankfully, sometimes there is a happy ending. Okay. This is the second one, 3 years old. Multiple bowel perforation from gunshot injuries. Again, he was. These are police cases. This is another police case that he was running away from police custody. So they shot him in the abdomen, and it was $2,000 left. They were spent. This is a 7-year-old boy. This was I think this was a stray bullet. Yeah, this was a stray bullet. This boy died, but with him, when we buried, same day, $1,000. 13-year-old, again, you see the sort of thing that you see. One day, that money goes. Another one, just to show you some of the plus. I'm not even counting the secondary costs, visits, loss of productivity, trauma, creating an environment that's not investor-friendly, and so on and so forth. This is another little girl. Imagine, 2.5 years. Some of the injuries. Maybe it's not the T-bone you're eating, but this is what they look like. Some of them are corrected. I removed the bad ones. I don't want you to start thinking that we are torturing you intentionally. Now, contextually, that's what I'm saying. It's very important when we're making the arguments, the use of data. That's good to put in context. So Zambia's problem really is, as I said earlier on, infectious diseases. And they're out of these, like TB, HIV, there are these opportunistic infections. And then, because of our intervention, sometimes we cause problems as physicians. HIV/AIDS, with interventions, develops resistance and it becomes expensive to treat. Then the other non-communicable diseases, like diabetes, cancers, road traffic injuries, are on the rise with urbanization and so on and so forth. Zambia GDP is very small, actually. It's, last time I visited my good friend Liz, I think your dog's budget was much higher than this. But that's Zambia's GDP. And there are always going to be all these shortages, erratic drugs supplies, infrastructure, the lack of investment. And then we like sending the big people, especially politicians, across South Africa to go and have the treatment. But also HIV and AIDS has an impact on the health workers. So there's a high attrition. You know, people who have money tend to higher sex. So they also succumb to the disease. They should be using condoms and things, but you know what beer does sometimes. Now, in context, this is, I'm using this just to make sure that we are comparing apples with apples. Because if we say that, what does it mean? There's a WHO commission, it's called the Abuja Commission, where my friend Ile comes from. For a country like Zambia to produce what's called a basic health package, in other words, package that doesn't include sophisticated investigations, basic things that can make a doctor make a decision 80% of the time in the top 10 diseases. Zambia would need about $3 per person per year, just basic. Look, this is nothing compared to many places. It's not enough to buy ice cream for 1 month in my friend's home. You need more to buy ice cream in the States. But this is per year. Now, this is a study period. I track down budgets every year. Now, this is in public. I want you to note, this is in public places, government hospitals in our case. But even if we added private, the average was, the best year was about there, which was somewhere here in the middle. Otherwise, it's between 6 and 10 US dollars, American dollars. And that does not include tertiary care, the teaching hospitals. We have 4 of them. So this 3 does not include tertiary care. But even if we included it, which we did, it only came to $12 per person per year. And Zambia is not a country in war. It's surrounded by war-torn places. Now, not included in the envelope, as I said, tertiary care, even the drugs for diseases that are of importance to us are not funded by the Zambian people. It's tax dollars from elsewhere. So malaria, TB, HIV, all these are programs. You know? Now we are doing this voluntary testing and counseling and testing, prevention of mother-to-child transmission. These are the medicines and retroviral therapy. Vaccinations such as DPT and HIV are not funded. Currently, the monies are coming from here, the global funds for HIV, AIDS, and TB, which is coming to an end very soon. But like organizations like Danida, like NORAD, and so on. This is the carry-over from President Bush. Actually, he also did some good things, you know. Like this one, President's emergency plan for HIV and AIDS. So one of the few good things the guy from Texas did was to do this. Now, here are the stories. If you look at the direct costs, they are very enormous. If we compare, you see one more slide down. Very enormous. Just to keep these figures in mind. We're not even counting these other costs. Cost of doing business, social impacts, economics, blah, blah, blah. And then all this, if you add to it. So, there's something that I missed. Let's go back. There's something that was. I changed slides midway. Okay, fine. I'll make the point here. So here is a call to all of us that actually, unless we make a paradigm shift, we'll be discussing this as if it's not important, because the numbers may be very small. They could be, like in this case, in that period I was talking about 2002, so 1998 to 2002, there are only, in that 5-year period, there are only 216 cases. But look at the money. See, it means for that gentleman who gobbled 3,000, what it meant is that 300 people had gone without the health care. That's what it meant, because it's $10 per person per year. So 300 people lost immediately. The other guy, so if you sort of aggregate those, you discover that a large number of people go without the health care because we think that guns are not important. It's a small issue. It's political, it's criminal justice, it's security. So we need to get involved and make those arguments. Also to show sometimes the pattern of injuries. Because if the police are shooting to kill, then we can tell from here that it's not true, that they are running away. There's a concept in my country where when police get fed up of losing cases in court, because they are very bad cases, they are poorly educated, poorly motivated, they shoot the criminals on sight and claim that they are running away from lawful custody. And the criminal can be anything. It can be you as a doctor going back home late, and the police doesn't like your sight, or So it can mean anything. Like those small 13-year-old, 3-year-old, 5-year-old, how can those be criminals? Even in Brazil, they are not that young. So, what is the story? The story is that we can use data creatively and make a point that guns, like in this case, are bad for people's health because they take away money from the things that we need to do. Thank you very much.